Health Break, brought to you by CHI St. Joseph Health.
If hip or knee arthritis stops responding to conservative treatments and a patient can no longer deal with the pain, a total joint replacement may become the best available option. Dr. Adam Franson from CHI St. Joseph London explains how these surgeries have improved.
With a joint replacement, really what you're doing is to replace or shave off the ends of those arthritic or painful areas and replace them with caps and then usually a plastic insert that goes in between those. We've really come a long way in what we can offer for pain relief options. Sometimes injections around the joint or in that leg can really alleviate a lot of the pain. We've also realized different ways to do knee replacements, and especially with hips, the same thing, different ways to get into the hip joint that causes less trauma to that area and therefore allows people to be able to recover quicker. Oftentimes people will go home after one night, sometimes even as an outpatient.
For more information, go to chistjosephhealth.org. I'm Beverly Herbert.